Welcome to CVMC. The purpose of this presentation is to review basic infection prevention principles and orient you to CVMC's infection prevention program. The program is how we identify and reduce the risk of infections from developing or spreading and to improve patient safety. Infection prevention also works to prevent hospital-acquired infections and minimize occupational exposure risk to healthcare workers. Objectives for this program include recognizing your role in preventing infection by following important key strategies like hand hygiene and isolation precautions. We will also review OSHA's bloodborne and airborne pathogen standards. You will learn resources for information and guidance to prevent the spread of infection at CVMC. Let's start with the basics. Germs spread from person to person through a series of events described as the chain of infection. There are 6 links that can be broken in the chain to stop the spread of infection. The first link is an infectious agent or germ that causes disease. The reservoir is the place where the germs live. In healthcare, the reservoir is usually healthcare workers' hands, medical equipment, or the environment. The portal of exit is the way the infectious agent leaves the reservoir, such as open wounds, aerosols, and splatter of body fluids, including coughing, sneezing, and saliva. Mode of transmission is the way the infectious agent can be passed on to other people. The portal of entry is the way the infectious agent can enter new susceptible hosts through broken skin, respiratory tracts, mucous membranes, or catheters and tubes. The way to stop germs from spreading is by breaking the chain at any link. Some of the ways to break the chain is by cleaning your hands frequently, staying up to date on your vaccines, including your flu shot, following good respiratory hygiene, the proper use of PPE, following isolation precautions, and staying home when you are sick. Good habits save lives. Always practice good infection prevention. Do not take shortcuts, even when you are busy. Hands are the most common mode of spreading germs. Hand washing can reduce the spread of antibiotic resistance in healthcare settings and the likelihood of healthcare-associated infections. CDC estimates that each year nearly 2 million patients in the United States acquire infections in hospitals, and about 90,000 of these patients die as a result. Hand hygiene by using soap and water or alcohol-based hand sanitizer remains the single most important means to prevent the spread of infection. Alcohol hand sanitizer should be used for routine hand hygiene because they reduce the number of germs on your hands, are fast-acting so they save time, and can actually cause less skin irritation than soap and water. Soap and water must be used when your hands are visibly soiled, after using the restroom, before eating or preparing food, and when caring for patients with diarrhea, including C. difficile. You are expected to perform hand hygiene before and after touching a patient or their environment, before a clean or aseptic procedure, and after exposure to blood and body fluids. Hand hygiene is also performed upon entering and exiting the patient room, as well as before and after using gloves. To comply with federal agencies, a team of hand hygiene observers are measuring our compliance of hand hygiene. An observer may remind you when a missed opportunity to perform hand hygiene is seen to protect yourself and your patients. When using alcohol hand sanitizer, be sure to use a palmful of foam or gel and rub the tops and bottoms of your hands. Be sure to rub between your fingers and fingertips as shown in pictures number 4 and 5. Rub until your hands are dry. Use the same principles when using soap and water, and be sure to wash your hands for 15 to 20 seconds to kill germs. Here is the difference of hands before and after disinfection. Don't be a victim of the hand germs. All types of artificial nails are not allowed for healthcare workers who provide direct care for our patients or prepare food, drugs, or equipment. Natural nails can be no longer than 1/4 of an inch. Nail polish is allowed as long as it is not chipped. Standard precautions, previously known as universal precautions, are guidelines that protect healthcare workers from exposure to blood and body fluids. All precautions must begin as soon as possible when the patients enter our facility at any site. Personal protective equipment is a major component of standard precautions. PPE is essential to protect your skin and mucous membranes from exposure to infectious or potentially infectious materials. PPE should be worn whenever there is potential for contact with spray or splashing of body fluids. It is your responsibility to know where to locate PPE in your department, to don PPE when appropriate, and to do hand hygiene as the final step after removing and disposing of PPE. All PPE is removed before leaving patient rooms or treatment areas. Standard precautions assume that all patients or residents are potentially infected or colonized with an organism that could be transmitted in the healthcare setting. Wear PPE according to the level of anticipated contamination when caring for patients and residents and when handling patient care equipment that is visibly soiled or may have been in contact with blood or body fluids. Remember, if it's wet and not yours, do not touch it without donning appropriate PPE. When donning PPE, the gown should be first, the mask or respirator should be put on next and properly adjusted to fit. Remember to fit check the N95 respirator. Goggles or face shields should be donned next, and the gloves are donned last. Wear gowns that cover skin and personal clothing likely to become soiled with blood or body fluids. Always tie your gown at the neck and waist to prevent potential blood and body fluid exposures. Remember to always change your gown when it becomes visibly soiled or as soon as possible if penetrated by blood or other potentially infectious fluids, and before leaving the patient room. Gowns are also worn when entering an isolation room area. When you can reasonably anticipate spraying or splashing of body fluids, wear a surgical mask that covers your nose and mouth to protect your mucous membranes from spray generated during procedures. Surgical masks are also used for droplet and sometimes contact precautions. Masks are changed between patients or if it becomes wet or damaged. Always remove your mask before leaving the patient room or area. You must either wear a full face shield or a combination of eye protection and mask if splashes, sprays, or spatters of blood or body fluid to the face could occur. Eyewear and masks may also be needed for isolation precautions. Gloves should always be worn when contact with blood and body fluids is anticipated. Gloves are also used for items and surfaces contaminated with blood and body fluids. Gloves are worn to minimize the risk of healthcare personnel acquiring infections from patients, to prevent germs from being transmitted from healthcare personnel to patients, to reduce contamination of healthcare personnel hands by organisms that can be transmitted from one patient to another. Wearing gloves does not eliminate or replace the need for hand washing. Hand hygiene should be performed before applying gloves and after removal of gloves. Remember, standard precautions are to protect the healthcare providers for every patient contact, every time. The sequence for removing PPE is intended to limit opportunities for self-contamination. The gloves are considered the most contaminated pieces of PPE and are therefore removed first. Remember to always remove your PPE before leaving the patient room or treatment area. Respirators are to be removed outside of the room. Make sure you remove your gloves safely to avoid possible contact with blood or other body fluids. Remove the glove of one hand with the other by grasping near the cuff and turning the glove inside out. Hold it in the gloved hand. Place the fingers of the bare hand inside the cuff of the gloved hand and also turn that inside out and over the first glove. Dispose of the gloves in a proper waste container. Clean your hands thoroughly after each glove use with soap and water or use an alcohol-based hand sanitizer. If your hands are visibly contaminated and there are no hand washing facilities, use the alcohol hand rub product followed by washing with soap and water as soon as possible. After removing your gloves, remove goggles or your face shield. Always grasp ear or head pieces with ungloved hands. Lift away from your face. Place in a designated receptacle for reprocessing or disposal. Before removing your gown, remember that the front and sleeve areas are considered contaminated. The clean areas are the back, ties, and inside of the gown, shown here in gray. To remove your isolation gown, unfasten the ties, peel the gown away from the neck and shoulder. Turn the front of the gown only touching the inside or clean part of the gown. Fold or roll into a bundle. Discard. To remove your mask, untie the bottom, then the top, remove from your face, and discard. To remove a particulate respirator, lift the bottom elastic over your head first, then lift off the top elastic. Discard. Always perform hand hygiene after removing PPE. Respiratory hygiene is another key strategy to prevent the spread of infection and prevent transmission of all respiratory infections. When coughing or sneezing, use a tissue to contain the sneeze or cough. Discard the tissue immediately and wash your hands. Remember to provide tissues and a way to discard the used tissue for our patients and residents. Another respiratory hygiene strategy when tissues are not available is to catch the cough or sneeze in your elbow. Let's spend a few minutes discussing MDROs, or multiple drug-resistant organisms. These are organisms that have developed resistance to antimicrobial drugs or antibiotics. In a healthcare setting, MDROs are spread by unwashed hands, gloves worn from patient to patient, contaminated environmental surfaces, inadequately cleaned and disinfected equipment, and inappropriate or prolonged use of antibiotic agents. MDROs are a growing threat to public health and are becoming more difficult to treat. Methicillin-resistant Staphylococcus aureus is a germ that causes infections in different parts of the body. MRSA is tougher to treat than most strains of Staphylococcus aureus, or staph, because it's resistant to some commonly used antibiotics. Vancomycin-resistant enterococci are bacteria that have become resistant to vancomycin, the drug often used to treat this type of infection. Enterococci are bacteria that are normally present in the human intestine, the female genital tract, and are often found in the environment. Most vancomycin-resistant enterococcal infections occur in hospitals. VRE can cause infections of the urinary tract, bloodstream, wounds, and can be associated with catheters or surgical procedures. Extended-spectrum beta-lactamases, or ESBLs, are enzymes produced by bacteria such as E. coli and Klebsiella. These germs are mainly bacteria that are found in the human bowel. ESBLs can be resistant to a range of frequently used antibiotics, including penicillins and cephalosporins. Urine infection is the most commonly diagnosed infection, but infection in the lungs, wounds, and blood can also occur. Carbapenem-resistant Enterobacteriaceae, or CRE, are gram-negative bacteria that also include E. coli and Klebsiella. They are resistant to the carbapenem class of antibiotics, which is considered the drug of last resort. CRE can cause serious infections such as pneumonia, blood, urine, wound infections, and meningitis. Some CRE bacteria have become resistant to almost all available antibiotics and can be deadly. One report cites they can contribute to death in up to 50% of patients who become infected. Prevention methods of MDROs include hand hygiene, which is the single most important way to prevent infection, always practicing contact precautions for every patient every time by using gloves and gowns, having dedicated equipment and supplies in the room, and being sure to properly disinfect equipment between patients, proper cleaning and disinfection of the room, education of staff and patients, prompt identification, isolation, treatment, and notification during transfers, and proper antimicrobial stewardship. Transmission-based precautions are designed for patients known or suspected to be infected by highly transmissible or epidemiologically important pathogens. Transmission-based precautions are used with standard precautions to stop the transmission of disease. Transmission-based precautions are broken down into 4 types: airborne isolation, droplet isolation, contact isolation, and protective isolation. Contact precautions are designed to reduce the transmission risk of epidemiologically important microorganisms, or MDROs, by direct or indirect contact. In addition to standard precautions, use contact precautions in the care of patients known or suspected to have a serious illness easily transmitted by direct patient contact or by indirect contact with items in the patient's environment. Illnesses requiring contact precautions may include, but are not limited to, MDROs, C. diff, scabies, lice, or draining wounds. When the patient is in contact precautions, place in a private room or cohort with others with like illness, and be sure to don appropriate PPE before entering the room. A red contact isolation sign will be posted on the patient's door. Remember, these organisms are spread by touch. We flag all positive MRSA, VRE, and ESBL patients so that they will be placed on contact precautions on readmission. Studies have shown that a patient may be colonized with MRSA for 40 months and VRE up to 42 months. We continue contact precautions until we can prove the patient is no longer infected or colonized. For patients with spore-forming organisms such as Clostridium difficile or any undiagnosed diarrhea, you must wash hands with soap and water. Alcohol-based hand sanitizer is not as effective as soap and water. An additional half-page green sign will be posted along with the red contact precaution sign. Droplet precautions used with standard precautions prevent infectious pathogens from traveling from the respiratory tract of an infected person to the mucous membranes of a susceptible host. These pathogens are spread when an infected individual coughs, sneezes, or talks, or during high-risk procedures such as suctioning or endotracheal intubation. Illnesses requiring droplet precautions include meningitis, influenza, and pertussis. A patient requiring droplet precautions should be placed in a single patient room. Persons having direct contact with the patient and those who will be within 3 feet of him should wear a surgical mask covering their nose and mouth. Airborne precautions, along with standard precautions, are designed to reduce the risk of infection from germs that can be spread through the air. Transmission occurs when tiny droplets or dust containing the infected agent are suspended in the air for long periods. The agent can float in the air currents of the facility and can be inhaled by susceptible people. To stop airborne transmission, the patient is placed in a specially ventilated room kept under negative pressure. An N95 particulate respirator is needed to filter out these particles that are expelled by the patient when they cough, sneeze, or talk. Fit testing for the N95 mask is done at higher and annually. Do not enter an airborne negative pressure isolation room without being fit tested for an N95 respirator or before performing a fit check. Isolation manuals are available on all nursing units and contain isolation signs and a list of communicable diseases that require isolation precautions. Prior to any patient transfer, be sure to alert the receiving department or facility that precautions are needed. Don't forget to include the need for precautions in the handoff report. Always follow standard precautions when handling soiled linen. All soiled linens are bagged at the site of use in a covered impervious laundry bag and in a manner that minimizes agitation and prevents contamination of the environment and personnel. Do not place dirty linens on the floor or furniture in a patient or resident room. All soiled linens are placed directly from the bed stretcher to a laundry cart. Linen bags are replaced when 3/4 full. The amount of linen taken into patient rooms is to be kept at the minimum level needed to address individual patient care needs. Clean linen is delivered in covered linen carts. Always keep linen covers down. Linen shall be stored covered on carts, shelves, bins, drawers, or linen closets. All patient care equipment must be disinfected with an EPA hospital-approved disinfectant between use. Disinfectants must be given the appropriate amount of contact time on the surface of the item being disinfected to assure disinfection. Equipment lists are available on the nursing units outlining cleaning and disinfection responsibilities and the products to be used. How do you know the equipment is clean? Clean equipment will be placed in a clear plastic trash bag or labeled with a green clean sticker. If a piece of equipment is not marked as clean, it is the user's responsibility to clean and disinfect it before using for another patient. In 1992, as a response to healthcare workers' concerns, OSHA mandated the bloodborne pathogen standard. This standard is law and requires that all healthcare personnel follow certain precautions to protect themselves. It is your responsibility to know and practice these precautions at all times. Bloodborne pathogens are pathogens that are present in blood or other potentially infectious materials that can cause disease. Diseases of concern are hepatitis B, hepatitis C, and HIV. Here is a list of other potentially infectious materials that may contain bloodborne pathogens. Other body fluids and materials such as saliva, tears, urine, and feces are not considered other potentially infectious materials unless they are visibly contaminated with blood. Bloodborne pathogens can be transmitted from an infected person to you when infected blood or body fluids gains entry to your blood or mucous membranes. For example, if you get cut with an object that is contaminated with infected blood, or if infected body fluid splashes into your eyes or mouth. Intact skin will prevent the transmission of bloodborne pathogens because bloodborne pathogens cannot penetrate intact skin. However, if your skin is chafed, cracked, or has cuts, abrasions, lesions, acne, or other openings, the pathogens could be transmitted to you. You can also become infected if you get infected blood or other body fluid on intact skin of your hand and then rub your eyes or put your fingers in your nose or mouth. Bloodborne pathogens can also be transmitted through sexual contact. Now let's talk about the primary diseases caused by bloodborne pathogens, hepatitis and HIV. The liver is a vital organ of your body that aids in digestion, filters blood, and fights infections. When it is damaged by hepatitis viruses, these functions can be impaired. There are several types of viral hepatitis, but the two of concern here are hepatitis B and hepatitis C. The hepatitis B virus can survive outside the body for more than 7 days in a dry state on a surface, such as a countertop or in discarded syringe. Hepatitis B is more contagious than HIV. There are over 1 million chronically infected Americans who are carriers. Those with chronic hepatitis infection are at higher risk for liver diseases such as cirrhosis and liver cancer. Approximately 3,000 people die per year from the disease or later complications such as liver cancer in the U.S. There is no cure, but fortunately there is a vaccine that can prevent you from getting infected and is effective before or after exposure. We will discuss the vaccine later in this presentation. Hepatitis C is the most common chronic bloodborne infection in the United States. An estimated 3.2 million people in the U.S. have chronic hepatitis C infections, and each year about 17,000 new people become infected. It may be as important as alcohol as a cause of chronic liver disease and is the leading reason for liver transplants in the United States. An estimated 12,000 deaths may be related to chronic hepatitis C infections each year, about 3 times the number from chronic hepatitis B infection. There is no vaccine yet available, but new treatments are becoming more effective in controlling the infection. The human immunodeficiency virus, HIV, is fragile compared to the hepatitis viruses. It does not survive well outside the body and can live in a dry environment for only a few hours. HIV attacks your body's ability to protect itself from disease. HIV is the cause of acquired immunodeficiency syndrome, or AIDS. There are now more than 1 million HIV-infected persons in the U.S. There is no cure and no vaccine available yet, although current drug treatments have greatly increased survivability of infected people in the United States. Many people who are infected with HIV do not have any symptoms at all for many years or may have only mild flu-like symptoms at first. Most persons who become infected with HIV will eventually develop AIDS, which is the most advanced stages of the infection. Some people develop AIDS within 2 to 3 years after infection, while very few have had no symptoms after 12 years. The time varies greatly from person to person and can depend on many factors, including a person's health status and health-related behaviors. The only way to know for sure whether you are infected is to be tested for HIV. You can't rely on symptoms to know whether or not you are infected. The HIV virus usually weakens the immune system to the point that it has difficulty fighting off certain opportunistic infections and cancers which overwhelm the immune system and cause life-threatening illness. Contact with blood or other potentially infectious materials from a sharps injury does not automatically mean you will be infected. Nevertheless, the risk is still there. The information here is from the Centers for Disease Control, CDC, as part of their Stop Sticks campaign. A copy of our written exposure control plan is located on Policy Manager. The exposure control plan is designed to eliminate or minimize your risk of exposure to bloodborne pathogens at work. It includes our policies and procedures and also identifies persons or departments with specific responsibilities. You should familiarize yourselves with it and refer to the procedures to follow if an exposure incident occurs. If you have any questions concerning the exposure control plan or would like a copy of the OSHA Bloodborne Pathogen Standard, contact the Infection Prevention Office at extension 4184. The risk of exposure to bloodborne pathogens at work can be reduced or prevented by the measures shown on this slide. The next several slides will cover these methods in more detail. We follow standard precautions. Under standard precautions, all patients are considered to be possible carriers of bloodborne pathogens. Standard precautions protects healthcare workers from contracting a bloodborne pathogen by wearing gloves when collecting or handling blood and body fluids, wearing face shields or goggles and masks when there is a danger of blood splashing on mucous membranes, and disposing of all needles and sharp objects in puncture-resistant containers. Safer medical devices have been developed to help prevent needle stick injuries. They must be used when they can to prevent or minimize occupational exposure to bloodborne pathogens. A list of all safety devices can be found on the route. Safe work practices are steps, procedures, or ways in which a job or task can be done more safely to minimize any exposure to blood or other potentially infectious materials. Don't bend, recap, or remove needles or other sharps. Don't shear or break needles. Place contaminated, reusable sharps immediately in appropriate containers until properly decontaminated. Sharps disposal containers should always be available when you handle needles. They must be closable, puncture-resistant, leak-proof, and labeled or color-coded. During use, place them as close as feasible to the immediate area where sharps are used or anticipated to be found. Keep them upright and don't allow them to overfill. Replace them when they are 3/4 full or sooner if necessary. If they need to be replaced or moved somewhere else, close them securely before you move them and place them in a large secondary container if leakage is possible. These common sense work practices help minimize your exposure to blood or other potentially infectious materials. Don't eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses in any work areas where there is a possibility of exposure to blood or body fluids. Don't place food or drink in refrigerators, freezers, shelves, cabinets, countertops, or bench tops in any other work areas where blood or body fluids are located. All work surfaces and equipment contaminated with blood or other potentially infectious materials must be cleaned up with an appropriate disinfectant as soon as possible or according to our written schedule. A list of who is responsible and what disinfectants are used is posted in the dirty utility rooms. During cleanup of spills and broken glassware sharps contaminated with blood or other potentially infectious materials, wear protective eyewear and a mask if splashing is anticipated. Remove glass and other materials using a brush and dustpan, forceps, hemostat, etc. Don't use your hands. Properly discard all materials into a sharps or puncture-resistant biohazardous waste container. When equipment, safer devices, and safe work practices do not eliminate exposure, the use of personal protective equipment, or PPE, is required. PPE that is appropriate will not permit blood or other potentially infectious materials to pass through or reach your clothes, skin, eyes, mouth, or other mucous membranes. Hepatitis B vaccine is provided free of charge to all employees at risk of exposure to bloodborne pathogens. The vaccination consists of a series of 3 different shots and is highly effective. If you choose to decline the vaccination, you must sign a declination statement. However, if you decide later at any time that you would like to have the hepatitis B vaccination, it will still be available under those same conditions. Just call Employee Health to schedule an appointment. If blood or other potentially infectious material splashes on you, gets in your eyes, nose, or mouth, or you accidentally stick yourself with a contaminated needle, you should do the following. First, don't panic. Remain calm. Actual infections from a splash or needle stick are quite low, less than 2%. Intact skin is an excellent barrier. Nevertheless, the following steps should be taken. Thoroughly wash the affected area. Wash needle sticks, cuts, and skin with soap and water. Flush splashes to the nose and mouth with water. Irrigate the eyes with clean water, saline, or a sterile irrigant. Report the exposure to your supervisor. If you are actually exposed to bloodborne pathogens, we provide a medical evaluation at no cost to you. The evaluation is confidential and will include testing for HIV, hepatitis B, and hepatitis C. With their consent, we will also test the blood of the source person and provide these results to you. Be sure to complete an incident report in Meditech. This is the only way our employee health nurses will be notified to follow up on lab work. If you do not know how to complete an incident report, your supervisor can help you. Containers containing blood or other body fluids or equipment contaminated with blood or other potentially infectious materials must have this orange-red label with the biohazard symbol. The following must be labeled: regulated medical waste, sharps containers, containers used to store, transport, or ship, contaminated equipment. Red bags or red containers may be substituted for labels. We use red bags for regulated medical waste. Now we are going to discuss our tuberculosis exposure plan. The TB exposure control plan is required by OSHA and is available in Policy Manager. The plan is designed to reduce risk of transmission of tuberculosis to our patients, employees, and visitors. At this time, we are considered to be at low risk for tuberculosis patients. Risk is reevaluated annually. TB is spread from person to person through the air. When people with lung TB cough, sneeze, or spit, they propel the TB germs into the air. A person needs to inhale only a few of these germs to become infected. Think TB during patient assessment. It is important to consider TB if a patient has these signs and symptoms and has been ill for 4 weeks or more. It's also important to remember only people with active pulmonary TB can spread the infection. Prevention strategies include early recognition and respiratory isolation. This slide shows the PPE that must be worn when caring for a patient that is suspected or known to have TB. Please don't forget that eye protection should be worn during activities that create aerosolization, such as during intubation, bronchoscopy, or suctioning. All staff entering the room of a known or suspected TB patient must wear a fit-tested N95 respirator and perform a fit check prior to entering the room. Staff will hang the blue airborne precaution sign on the door, alerting all visitors and staff of the need for precautions. Patients that are suspected or known to have TB must be placed in a negative pressure room. Please do not forget that all of the doors must be closed in order for the negative pressure to work. If for any reason we do not have a negative pressure room available, the patient must be transferred to a facility that does within 5 hours. While waiting transfer, the patient will be masked or segregated to prevent exposure. It may be hard to believe, but over the last decade, syringe reuse and misuse of medication vials have resulted in dozens of outbreaks and the need to alert over 100,000 patients to seek testing for bloodborne pathogens such as hepatitis B, hepatitis C, and HIV. To prevent transmission of infections in healthcare, always use one needle, one syringe, only one time. Always remember safe injection practices. Use aseptic technique. Do not administer medications to multiple patients using the same syringe, even if the needle is changed. Do not reuse a syringe to access medications from a vial that may be used on multiple patients. All our vials are single-use, even if they are marked multiple use. Infections can spread when healthcare workers come into work when they are sick. Please do not put others at risk. If you have any of the above listed conditions or other infectious illnesses, do not come to work. For some conditions, it will be necessary to obtain fitness for duty clearance from employee health before reporting back to your regular duties. It is especially important that you do not come to work with flu-like symptoms. Influenza is a severe respiratory illness. It is considered highly contagious and is spread by an infected person coughing or sneezing. The flu can also be spread by direct contact with surfaces that are contaminated. Individuals are contagious for 1 day before the onset of symptoms and about 5 days after the first symptoms. Approximately 50% of infected people are asymptomatic but contagious. Symptoms include sore throat, bad cough, body aches, chills, fever of 100 or more, and extreme fatigue. You are putting your family, friends, co-workers, and your patients at risk if you do not get a flu shot every year. When working in healthcare, it is vital to keep yourself healthy. One of the ways that we do this is by being sure that we are up to date with all of our vaccines. Don't forget, adults need vaccines too. They are not just for children. Be sure that you have had vaccines or have natural immunity to the conditions listed above. Call Employee Health at extension 4323 if you are not sure that your vaccines are up to date. To review, remember to always practice the 5 moments of hand hygiene. Be sure to foam in and out of patient rooms with alcohol-based hand rub. Commit to 15-second hand wash or routine use of alcohol-based hand rub. Gloves are not a substitute for hand hygiene. Perform hand hygiene both before and after gloves. Every patient, every time. It is your responsibility to know where the PPE is in your department. Don and doff PPE properly. Follow isolation precautions every time, every patient. Be sure all your vaccinations are current. Thank you for choosing to be part of our team at CVMC. If you ever have any questions, comments, or concerns, please feel free to reach out to the Infection Prevention Office at 371-4184. We are also available through email or text page.